Morning, Jonathan.
Morning, Emily. How are you today?
Yeah, I'm good, thank you. And you?
Not bad, not bad. It's been a really extraordinary first 2 months of the year, hasn't it?
Absolutely, yeah. Didn't quite go the way we hoped at the end of last year, and then coming back to the new year with the increased cases, obviously. But I suppose more recently, it's been really encouraging seeing the cases come down.
Yeah, definitely. It's a real positivity around at the moment, and thankfully some dates that people can start to look forward to, which I'm sure we'll talk about a bit later in the chat.
Yeah, it's really helpful, and obviously then seeing all the vaccination numbers going up and up and up is just fantastic. Although I know we're really conscious of kind of ensuring people are still adhering to those prevention measures around social distancing, wearing face coverings, etc. So just because you're vaccinated, you shouldn't relax on those measures, but still it is very encouraging to have that rolling out.
Definitely, and the pace in Warwickshire has been quite extraordinary. We've seen one of the fastest rates across the country, haven't we, in terms of the rollout of vaccinations. So fantastic work by NHS colleagues and all those people who've taken part in achieving that.
Absolutely, all the volunteers that have come forward to support the programme has, again, just been amazing. So shall I take us through the latest data?
And then yeah, that would be great.
Great, and then we can talk a little bit about what's to come over the next few weeks and months. So overall, our positive cases are coming down really nicely. You can see here from that peak in early January, slight bit of a levelling off now, but still really good to see those cases coming down. And as a reminder, the pink bars represent those positive cases that have been tested in the community, and the blue within health and care settings. And you can see they're at very low numbers now, which is great. And then wanted to just look at the over 60s. Again, looking really good there, and potentially starting to see some of the impact of the vaccination programme, particularly in the kind of over 80s, but perhaps a little bit of an increase. We're levelling off. So again, just making sure people are being really careful after they've had their vaccine to still adhere to the prevention measures as we discussed. So this one shows by district and borough, and you can see broadly they're all still on that downward trend, perhaps a little bit of a blip most recently, and North Warwickshire has seen a recent increase. Now, North Warwickshire population is fairly small, so actually it doesn't take a huge number of cases to push the rate per 100,000 up a bit. And we were discussing this earlier, Jonathan. Sometimes it could be a spread within one household or a small outbreak that can just make that difference. Now we've got quite low numbers overall.
Yeah, and I think there's also something about the types of businesses, isn't it, that operate within North Warwickshire. You know, we've got large distribution centres, big logistical companies, often people who are working fairly close proximity, and we've worked really hard to get some of those businesses to take extra measures on, but it doesn't take a lot for a small transmission to affect quite a large group of people in those areas. So we're very conscious that we just can't take our foot off the gas at the moment. It's, you know, this hasn't gone away, has it? And that just gives an indication about just how important it is we stick to the measures we know that are working.
Absolutely. And I think, you know, broadly speaking, we've been really pleased with the businesses and the measures that they've put in place, taken on board advice, and obviously do really want to keep their workforce safe as well, because it has an impact on their business as well as their employees. So yeah, I know we've said it before, but you know, I can't reiterate enough really how grateful we are for those people that are still having to go into work and potentially face that slightly increased risk compared to those of us that can work from home. So this picture at the bottom kind of reflects that. So the darker colours being the age groups where we've had higher numbers of cases, and you can see over the last 3 weeks really the darker colours really being within that working age population group there. And on that point, obviously we're rolling out, or we have already rolled out 6 community rapid testing sites, which anybody can access. We're encouraging people who are still having to go into work to access those at the moment. So the intention of the rapid testing, or the lateral flow tests, is to give you is for people who are asymptomatic, so people without any symptoms, but to go along weekly and to pick up any asymptomatic carriage. So about 1 in 3 people, we estimate, that pick up coronavirus have no symptoms. So it's really important that we do start to get on top of this. And you can see we've identified over 750 cases through this route that we wouldn't have otherwise known about. So that's going to have a really good impact on our local transmission. We're also working with businesses now to support them in terms of getting their own in-house testing set up too, which again will be a really positive development. But I wanted to show this slide because, as I say, it's mainly the working age population where we're getting higher numbers of cases. So we really do want to encourage people in that 20 to 49 age group to come forward for lateral flow tests. Older working age population as well, but we've got quite good uptake there. So I think it's that message around getting younger people to come forward for the test when they don't have any symptoms. So I can understand why it's perhaps not too motivated to do. I think why would I need to go for a test if I don't have symptoms? But it's really important, as I say, around picking up any infections that we wouldn't otherwise know about.
Yeah, I think people need to understand, don't they, that lateral flow test is going to be part of the pace of a working week. If people are going into an office or a retail to a business to start working on a regular basis again, then having an LFT done once a week, or in some cases even twice a week, will be the kind of thing that people will be looking to. So if you're in the personal care sector, for example, doing close contact work with people, we would be encouraging you to have an LFT probably twice a week. We've had many of our staff attending LFT sites, those that have had to continue going in, and the byproduct of LFTs is actually some confidence within staff, because they regularly report back that they've had negative tests, and actually there's a real reassurance for them with the people that they're working with as a group, that they're on the right track. So, I think people have just got to kind of understand that LFTs are going to be part of the new normal.
Yeah, they're going to be around for some time, aren't they? But it's really great, as we were saying earlier, Jonathan, before we started this little video blog, you get your results within an hour. It's texted to you, so it's really convenient. Again, it's worth being cautious because obviously that negative test result is valid at that time. You could walk out of the test centre and pick up COVID. So again, it's about not relaxing on your general prevention measures. But as you say, as you kind of introduce it on a really routine basis into workplaces, it can give a really good level of protection and reassurance. So we're going to have a look at the roadmap. I'll just make that larger on my screen. So we've got 4 key tests that the government nationally, and we're reflecting that locally, will be considering in terms of carrying on forward through the plan stages of the roadmap. So vaccine development programme continues successfully, and that the evidence is showing that the vaccinations are reducing hospitalisations and deaths in those vaccinated. I think we're seeing quite positive impacts, albeit very early signs at the moment. But as I say, some cautious optimism around that. We'd want to make sure we don't see a surge in hospital admissions, which would lead to pressures on the NHS. They are still feeling those pressures, albeit that it's coming down. They're still at a high level in terms of having to support people with COVID, and therefore knock-on impacts on non-COVID related care as well, which they're trying their best to minimise. But yeah, they are still very much feeling that pressure at the moment. And then the final test being around not seeing any new variants of concern that fundamentally change our kind of assessment of risk around reopening as through the roadmap stages. So Jonathan, do you want to take us through the key steps within the roadmap?
Yeah, sure. There's a few in here, and quite a lot of work to be done with different sectors and different businesses. But it's as people probably know, the government's announcements is that from the 8th of March, schools and colleges can start to go back, and that's a real positive step. I know there'll be lots of mixed views around that, but for many of our young people, being at school, that social element, the importance of that is absolutely vital. So some really good signs on that. And then as I'm sure people watching this webinar will know, there's a gap between each of the different stages, just to assess how that's impacting, what the impact that has on the wider community. But the plan then is to move to the 29th of March and to expand greater opportunity for people to contact be in contact with each other, increasing so that people can go outdoors and mix in slightly larger groups of up to 6 or 2 households, and then the reintroduction of outdoor sports and leisure, which again I know will be a huge welcome for so many people. So the focus really around the 29th of March is much more of that kind of interactive social well-being agenda, and I think again that's really welcome. And then moving into April, so from around about the 12th of April, should things go well, then we're going to start to see the reopening of non-essential retail, personal care and outdoor hospitality, which again I know will be hugely welcome to so many people. There's also some changes in terms of being able to stay away, which again will be really welcome, and things like indoor leisure facilities such as gyms, etc., will again be able to reopen. So again, for many people, this is a significant date when we're seeing our high streets coming back to life, and that kind of interaction within across our retail sector.
And it's really nice seeing that coinciding with spring. We're quite lucky, really, aren't we, in terms of
absolutely
something to look forward to with the better weather as well.
Absolutely, and I know so many businesses are looking forward to working and planning on that, and we're trying to get some advice for them now, ready for those opening dates, just so that they've got some really good thoughts to put into place that we've learned from the last couple of months. Some of the extra measures that we'd be like to work with people. So that's something we're very much looking forward to do. And then moving into May, again, things I know that people are hugely looking forward to, more events, indoor events, cinemas, theatres, reassessing how they can open and planning to open, applying some of those restrictions that they had in before. So limited numbers, but again, people are just clamoring, aren't they, for that that entertainment, that kind of normal activity that's been going on and so sorely missed. Larger groups, being able to meet outdoor, opening up of further accommodation. So I know there's been a real clamour for people booking holidays already, and some real genuine hope that those dates will remain, that can start to stay in place. And of course, international travel. We haven't yet seen. Good fingers crossed there, Emily. We haven't yet seen what the government's line is going to be really in terms of certification, etc. But again, I would just be reiterating the importance of the vaccination programme. Hopefully by mid-May, lots of those top 9 category groups will have been had their first dose, been offered their first dose. But things like LFTs and CRPs, PCRs will be really important as part of that planning. And then finally, should things go to plan, 21st of June, the remaining sector larger events, perhaps some of the festivals and events that are being considered for the latter part of the summer, we can start planning for some of those to take place. Again, there's a caveat on that. We need to make sure that we don't kind of go from 0 to 100 miles an hour. Some planning on some smaller events, perhaps some changes in how they operate, but at least the opportunity for that to happen.
Absolutely.
So it's all subject to change, but as I said right at the beginning, it's nice to have some dates just to think we can start looking forward to.
Yeah, absolutely. And so obviously, as you say, it'll be against review of those 4 key tests at the start, but we've also got our own local criteria, which we'll be reviewing as we go through as well, in terms of case rates, etc. And obviously we had the good news that they're bringing vaccination programs forward. So the ambition is to vaccinate all adults by the end of July. So that will be really positive in terms of getting back to more normality. But as I've said a few times already, we still need to maintain those safe behaviours, and particularly as things open up earlier than younger adults will have been vaccinated. So just a reminder there on screen of the key prevention behaviours and how to stay safe when out and about. I won't go through all of them because I think people will have heard them many times already, but key ones really around meeting outdoors if you can, certainly much lower risk of transmission outdoors, and if you are indoors, maximising the amount of fresh air that you can get in. So I think those were the two key newer ones that I wanted to highlight today.
Yeah, I think the one that we've really been pushing, haven't we, over the last 2 months is the issue around distance, social distance. We've had lots of challenges with supermarkets across the county, and actually saying to them that 2 meters is the minimum. Let's not have a conversation about how we can find ways of having it lower than that. People are back to back or closer proximity. It's 2 meters, and in many ways, many places, we'd actually like to see that a bit more than 2 meters. So I think that is going to be one of the constant messages that we'll be pushing out, particularly when certain venues start to open, restaurants, pubs, etc. We will definitely be encouraging them to hold and maintain that 2 meter distance.
Yeah, fantastic. And your team have been doing great work with supermarkets and smaller convenience stores recently to review their measures and make recommendations where improvements are needed. And I think it's been a relatively small number where improvements have been needed, but they have taken on board the advice, haven't they? So I think that's been really valuable work.
They have, and I would just want to add that it's really noticeable how many people are more willing to challenge some of the behaviours in the supermarkets, and you don't have to do it in an aggressive or difficult way. You can do it in a way that actually acknowledges some of the changes that have been made, and just thanking the staff who are perhaps on the tills, the cashiers, the security people, just to say thank you makes a big difference to us, because actually that keeps on going back. It reiterates the message of how important this is. And I know a lot of people who will watch this from across the community and voluntary sector. It's a really important message. We've all got a power and authority to influence this just by having those conversations with people. And I would absolutely encourage you to do that, and just say to people how important it is that someone's wearing a face covering to keep yourself safe.
That's a really good point. It's a sign of caring, isn't it?
Absolutely. Yeah.
Lovely. Well, on that note, just want to say thank you to Jonathan. Thank you to all that are watching, and to stay safe and take care of yourselves.
Yeah, take care, everybody.